What if the very medications you trust every day could be quietly stealing your memory? Imagine waking up one morning and forgetting where you placed your keys, then forgetting a familiar name. A few months later, you struggle to remember important appointments or conversations you had just yesterday. Most people assume this is simply a normal part of getting older. But what if that's not the whole story? Today, we're uncovering a shocking and often overlooked reality. Some of the most commonly prescribed and over-the-counter medications used by millions of adults over 60 have been linked to memory problems, confusion, cognitive decline, and in some cases, a significantly increased risk of dementia-like symptoms. Now, this doesn't mean these medications are dangerous for everyone. It certainly doesn't mean you should stop taking any medication on your own. However, it does mean that understanding the potential risks could make a life-changing difference for you or someone you love. In this video, we'll reveal 9 popular medications that researchers and medical experts have repeatedly flagged for their potential impact on brain health. More importantly, we'll explain why these drugs can affect memory, who is most at risk, warning signs you should never ignore, and the safer alternatives you may want to discuss with your healthcare provider. The final medications on our list may surprise you, because many people take them every single day, without ever suspecting they could be affecting their brain. If you're over 60, caring for an aging parent, or simply want to protect your memory for years to come, stay with us until the very end. The information you're about to hear could help you safeguard one of your most valuable assets, your mind. As we get older, occasional forgetfulness is often dismissed as a normal part of aging. Misplacing your glasses, forgetting a name for a moment, or walking into a room and forgetting why you went there can seem harmless. However, what many people don't realize is that some memory problems may not be caused by aging alone. In certain cases, the medications people take every day could be playing a significant role. This is especially important for adults over 60, whose brains may become more sensitive to the effects of certain drugs. Researchers have found that some commonly used medications can interfere with the chemical lozenges that help brain cells communicate. When these signals are disrupted, memory, attention, and thinking abilities can suffer. The effects may begin gradually, making them easy to overlook. A person might feel mentally slower than usual, have difficulty concentrating, struggle to recall recent conversations, or experience increasing confusion during daily activities. Because these symptoms often resemble the early stages of dementia, the true cause can be missed for months or even years. Another concern is that many older adults take several medications at the same time. Even when each drug is considered safe on its own, combined effects can sometimes place additional stress on the brain. This phenomenon, often called polypharmacy, has become increasingly common among seniors and is associated with a greater risk of cognitive problems. The more medications a person takes, the more important it becomes to regularly review them with a healthcare professional. One of the most alarming aspects of medication-related memory issues is that they may be partially reversible in some cases, when the underlying cause is identified. Recognizing the possibility that a medication could be contributing to cognitive changes is an important step toward protecting long-term brain health and maintaining independence, mental clarity, and overall quality of life as the years continue to pass. Sleep problems become increasingly common after the age of 60. Many older adults struggle with falling asleep, staying asleep, or waking up multiple times during the night. As a result, sleeping pills are often viewed as a quick and effective solution. While these medications can provide temporary relief, some of the most commonly used sleep aids have raised concerns among researchers and healthcare professionals because of their potential effects on memory and cognitive function, especially when used regularly over long periods. Certain sleep medications work by slowing activity in the brain to create a feeling of relaxation and drowsiness. Although this can help a person fall asleep more easily, it may also affect the brain's ability to process, store, and retrieve memories. For some individuals, the result can be episodes of forgetfulness, difficulty concentrating, slower thinking, and confusion during the day. These effects may be subtle at first and are often mistaken for normal aging or fatigue. Older adults are particularly vulnerable because the body processes medications more slowly with age. A dose that seems appropriate may remain in the system longer than expected, increasing the likelihood of side effects. Some people report feeling groggy or mentally foggy even after a full night's sleep. Others may experience balance problems, dizziness, or difficulty performing tasks that require attention and coordination. Research has also suggested that long-term use of certain sleep medications may be associated with an increased risk of cognitive decline. While studies continue to investigate the exact relationship, many experts recommend using these medications cautiously and only when truly necessary. Sleep is essential for brain health, but relying heavily on medications to achieve it may not always be the safest long-term strategy. Improving sleep habits, maintaining a consistent bedtime routine, limiting caffeine late in the day, and addressing underlying medical conditions that interfere with sleep can often provide meaningful benefits. Understanding how sleep medications affect the aging brain allows individuals to make more informed decisions and take proactive steps to support memory, mental sharpness, and overall cognitive well-being as they grow older. Many people are surprised to learn that some of the medications found in their medicine cabinet for allergies, colds, and sinus problems may have unexpected effects on memory and brain function. These drugs are often available without a prescription and are commonly used to relieve symptoms such as sneezing, runny noses, itchy eyes, congestion, and seasonal allergies. Because they are so familiar and easy to obtain, many adults assume they are completely harmless. However, for people over 60, certain allergy and cold medications deserve closer attention. Some older antihistamines work by blocking a chemical messenger in the body called acetylcholine. This chemical plays a critical role in learning, memory, attention, and communication between brain cells. When acetylcholine activity is reduced, cognitive function can be affected. Older adults may notice increased forgetfulness, difficulty concentrating, mental fog, or episodes of confusion. In some cases, family members are the first to recognize that something seems different about a loved one's thinking or behavior. The risk becomes even greater when these medications are taken frequently or combined with other drugs that have similar effects on the brain. Since many seniors take multiple prescriptions and over-the-counter products, the cumulative impact can become significant over time. What begins as occasional use during allergy season may gradually turn into a routine habit without the person realizing the potential consequences. Another challenge is that symptoms caused by medication can closely resemble the warning signs of early dementia. An individual may struggle to remember recent events, lose track of conversations, or have difficulty staying focused. These changes can create unnecessary anxiety and may lead people to believe they are developing a serious neurological condition when medication could be contributing to the problem. Fortunately, newer allergy treatments are often available that have less impact on brain function. Discussing symptoms and medication choices with a healthcare provider can help identify safer options. Being aware of how common allergy and cold medicines may affect cognitive health is an important step toward protecting memory, maintaining mental clarity, and supporting healthy brain function throughout the aging process. Anxiety, stress, and nervousness can affect people at any age, but many adults over 60 find themselves facing new challenges that increase emotional strain. Health concerns, retirement, financial pressures, loss of loved ones, and changes in daily routines can all contribute to feelings of anxiety. To manage these symptoms, doctors may prescribe medications designed to calm the nervous system and provide relief. While these medications can be very effective when used appropriately, some have been associated with memory problems and cognitive decline, particularly when used for extended periods. These medications work by slowing certain types of brain activity, helping individuals feel more relaxed and less anxious. However, the same calming effect that reduces anxiety can sometimes interfere with important brain functions such as memory formation, concentration, decision-making, and mental alertness. Older adults may notice that they become more forgetful, have trouble recalling recent conversations, struggle to focus on tasks, or feel mentally sluggish throughout the day. Age-related changes in the body make seniors especially sensitive to these effects. As people grow older, the liver and kidneys often process medications more slowly, allowing drugs to remain active in the body for longer periods. This can increase the risk of side effects and make cognitive symptoms more noticeable. In some cases, individuals may experience confusion, disorientation, or difficulties with balance, which can further affect independence and quality of life. Another concern is that prolonged use may lead some people to rely on these medications for months or even years. Research has suggested that long-term exposure to certain anti-anxiety drugs may be associated with an increased risk of cognitive impairment. Although scientists continue to study this connection, many healthcare professionals encourage regular medication reviews to ensure that benefits continue to outweigh potential risks. Managing anxiety remains important because chronic stress can also negatively affect brain health. The goal is not to avoid treatment, but to use the safest and most appropriate approach possible. Stations such as lifestyle changes, relaxation techniques, physical activity, counseling, and other supportive therapies may sometimes help reduce anxiety while preserving mental sharpness, memory function, and overall cognitive well-being. As individuals continue to age, many adults over 60 take medications for bladder problems, chronic pain, digestive issues, or stomach discomfort without giving much thought to how these treatments might affect the lay brain. These medications are often prescribed to improve quality of life and manage common age-related conditions. However, some of them contain ingredients that may influence memory, concentration, and overall cognitive function, especially when used regularly or in combination with other medications. Bladder control medications are among the most commonly discussed in this category. Certain drugs used to treat overactive bladder work by blocking chemical signals that trigger frequent urination. Unfortunately, some of these same chemical pathways are also involved in memory and learning. When these signals are disrupted, older adults may experience forgetfulness, confusion, difficulty focusing, or a general feeling of mental fog. Because these changes often develop gradually, they may not immediately be linked to the medication itself. Pain medications can also present challenges for cognitive health. Some stronger pain relievers may cause drowsiness, slower thinking, reduced attention, and memory difficulties. In older adults, these effects can be more pronounced due to age-related changes in metabolism and medication sensitivity. Persistent mental cloudiness may interfere with daily activities, social interactions, and the ability to live independently. Certain medications used to manage stomach problems, including long-term treatments for acid reflux or digestive discomfort, have also attracted attention from researchers. While these medications can provide significant relief, some studies have explored possible associations between prolonged use and changes in cognitive function. Although research findings remain mixed and do not prove a direct cause and effect relationship, they highlight the importance of using medications thoughtfully and reviewing them regularly with a healthcare professional. The greatest risk often occurs when multiple medications with similar cognitive side effects are taken together. This combination can increase the burden on the brain and make symptoms more noticeable. Regular medication reviews, open communication with healthcare providers, and awareness of potential side effects can help identify concerns early. Understanding how bladder, pain, and stomach medications may influence brain health empowers older adults to make informed decisions that support memory, mental clarity, and long-term cognitive wellness. Learning about medications that may affect memory can be concerning, especially for adults over 60 who rely on these treatments to manage important health conditions. However, the most important message is not to stop taking any prescribed medication without professional guidance. Abruptly discontinuing certain drugs can lead to serious health complications, withdrawal symptoms, or worsening of the condition being treated. Instead, protecting brain health begins with becoming informed and working closely with healthcare providers to make the safest decisions possible. One of the most effective steps older adults can take is to schedule regular medication reviews. Many people continue taking medications for years without reassessing whether they are still necessary or whether newer alternatives are available. A healthcare professional can evaluate all prescription medications, over-the-counter products, vitamins, and supplements to identify combinations that may be contributing to cognitive symptoms. Even small adjustments can sometimes make a meaningful difference in mental clarity and overall well-being. Keeping an up-to-date list of all medications is also valuable. This simple habit helps doctors and pharmacists identify potential interactions and recognize drugs that may affect memory or thinking. Because many cognitive side effects develop gradually, tracking changes in memory, focus, or mood can provide useful information during medical appointments. Lifestyle choices play an equally important role in preserving brain function. Regular physical activity increases blood flow to the brain and supports healthy cognitive crush or aging. A balanced diet rich in fruits, vegetables, healthy fats, and nutrient-dense foods provides essential support for brain cells. Quality sleep allows the brain to repair and organize memories, while social engagement and mentally stimulating activities help maintain cognitive resilience over time. Managing chronic conditions such as high blood pressure, diabetes, and heart disease is another key part of protecting memory. These health issues can affect blood flow to the brain and increase the risk of cognitive decline if left uncontrolled. By combining careful medication management with healthy daily habits, older adults can take proactive steps to support mental sharpness, preserve independence, and reduce factors that may contribute to memory loss as they continue to age with confidence and greater awareness. Measure 2. Here's the final conclusion for your speech. As we come to the end of this discussion, remember that protecting your memory is not just about solving crossword puzzles, taking supplements, or staying mentally active. Sometimes, one of the most important steps is taking a closer look at the medications you use every day. Truth is that some popular drugs, especially when used long-term or in combination with other medications, may contribute to confusion, memory problems, and cognitive decline in older adults. Yet many people never consider that their prescriptions or over-the-counter medications could be affecting their brain health. This information is not meant to create fear or encourage anyone to stop taking necessary treatments. Instead, it is meant to empower you with knowledge. The good news is that medication-related cognitive problems can sometimes be identified and addressed before they become more serious. A simple conversation with your doctor or pharmacist, a review of your medication list, and greater awareness of potential side effects may help protect your memory and improve your quality of life. Your brain is one of the most valuable assets you have. It holds your memories, experiences, relationships, and independence. Taking proactive steps today can make a meaningful difference in how well your mind functions tomorrow. Stay informed, ask questions, and never assume that every symptom is simply a normal part of aging. If you found this information helpful, be sure to share it with friends, family members, and loved ones over 60. Someone you care about could be experiencing memory problems without realizing that a medication may be playing a role. The more we understand the factors that influence brain health, the better equipped we are to preserve our cognitive abilities and enjoy a healthier, more independent future. Thank you for watching. Take care of your health, and take care of your mind, because protecting your memory today may help safeguard your future for years to come.